for you. Do you get hyperthyroidism and hypothyroidism mixed up? You're not alone. Nursing exams love to test these because they're opposite thyroid conditions with totally different symptoms. So in this video, I'll break them down side by side with simple mnemonics so you'll never confuse them again. So let's get started. So before I begin on hypo and hyperthyroidism, let's just do a quick thyroid refresher. So your thyroid gland makes hormones T3 and T4, which controls metabolism. So basically your body's energy speedometer, okay? Too much thyroid hormone, everything speeds up. Too little thyroid hormone, everything slows down. So if you kind of keep that in mind, the rest will make sense and it'll make it easy for you. So let's begin. Let's start with hyperthyroidism. So hyperthyroidism is too much thyroid hormone. So the T3 and the T4 are elevated and your TSH is low, okay? So when you think of hyperthyroidism, you're thinking that your body is stuck on fast forward, okay? And so what causes this? Graves' disease, which is an autoimmune disease, a toxic multinodule goiter, and a thyroid storm, which is a life-threatening emergency. So when a patient comes in with hyperthyroidism, what are you going to see? You're going to see weight loss. Despite them eating, they're going to have weight loss. They're going to have an enlarged thyroid gland, okay? They're going to have heat intolerance. They're going to sweat, and they're going to have diarrhea. They're going to have tachycardia on the cardiac monitor, complain of palpitations. They're going to have hypertension. You may also see atrial fibrillation on the cardiac monitor. They may be irritable. They may be very anxious. They may have trouble sleeping, so they'll have insomnia, and they may even have mood swings. They'll also have exophthalmos, which is the bulging eyes, so the protruding eyeballs, okay? So what would you see from the provider? What kind of treatments would you see? You'll see orders for anti-thyroid medicines like methimazole or propylothyrouracil, and both of those kind of block thyroid synthesis. You may see orders for radioactive iodine, which will destroy the cells in the thyroid. So, stopping the release of the thyroid hormone. You may see orders for surgery. So as the nurse, you're going to start preparing the patient to go to surgery. And you may see orders for beta blockers like propranolol, which they would use for the tachycardia. And that's kind of it for hyperthyroidism. So moving on to hypothyroidism. Hypothyroidism is too little thyroid hormone. The T4 is low, excuse me, and the TSH is elevated. So the body is in slow motion. Excuse me. So the most common cause, Hashimoto's thyroiditis, which is an autoimmune disease. You'll see hypothyroidism and iron deficiency, post-thyroidectomy, or post-radioactive iodine treatment. So when you're trying to correct the hyperthyroidism, it will put you in hypothyroidism. So what signs and symptoms are you going to see with your patient? They're going to have weight gain despite poor appetite. They're not going to be eating, but they're going to steadily gain weight. They're going to have cold intolerance, bradycardia, hypotension, lethargy, weakness, fatigue, depression. So basically the opposite, okay? Hair loss, brittle nails, dry skin, constipation. You'll see myxedema, where it's a generalized puffiness and edema around the eyes and the face. They also say that myxedema, you'll see swelling, so that edema, but also thick skin. And when that patient comes in with hypothyroidism, what treatments will you see? You're going to see orders for levothyroxine. That is the most common, and that is a lifelong thyroid hormone replacement, so levothyroxine. And so with levothyroxine, because you're treating hypothyroidism, you need to watch for tachycardia, chest pain, insomnia. So when patients are on levothyroxine, the providers need to start low dose, and slowly titrate up, especially in cardiac patients, because that levothyroxine can make that hypothyroid person become hyperthyroid. So you really have to watch your patients. So you're going to monitor for vital signs, heart rate, and rhythm, because with starting the levothyroxine, you can, if it's too much or they have an overdose, they'll start having an AFib and a tachycardia. So that's why we're going to be monitoring the vital signs. Prevention for constipation. With hypothyroidism, a person will be at increased risk of constipation. So increasing their roughage, water consumption unless it's contraindicated, things of that nature. So that's basically hypothyroidism real quick. So when you look at them side by side, hyperthyroidism, think high and hot. Increased metabolism, increased heart rate. So because they have a high metabolism, they'll have weight loss and heat intolerance. For hypothyroidism, low and slow, low metabolism, low heart rate. Weight gain, because of the low metabolism, they'll gain weight, and cold intolerance. So think high, hot, and hyper. Think low, slow, and cold. So if they have hyperthyroidism, everything is going to be high and they're going to be hot. If you think in hypothyroidism, everything is going to be low and they're going to have cold intolerance. And so that's basically it. I mean, hopefully I've made it simple enough for you. Hyperthyroidism, like I said, fast forward, everything's moving fast and high. Hypothyroidism, everything is slow. Everything in the body is moving in slow motion. So like I said, high and hot versus low and slow. And if you can remember that, you'll ace any thyroid question. So if this helped, please give this video a thumbs up. Please subscribe to NurseEdScholar. Check out my other endocrine videos. I made one on SIADH versus diabetes insipidus. I apologize for the coughing. I don't know where that came from. But please subscribe, please like, please comment. Please come back to watch for more videos. And I hope this video helped you. So until next time.